Welcome to Conversations in Tinnitus, a video podcast of the American Tinnitus Association. The American Tinnitus Association is a public charity under Section 501c3 of the Internal Revenue Code, a charity dedicated to research, advocacy, education, and support for people living with tinnitus, including their families. Conversations in Tinnitus video podcasts reflect our mission to amplify the patient voice, showcase evidence-based and promising emerging treatments, and highlight cutting-edge research. All of this is made possible through your generous support. Thank you. Hello, and welcome again to our series for Tinnitus Awareness Week on behalf of the American Tinnitus Association and our mission to silence tinnitus. Thanks for logging on, tuning in, downloading this conversation. We are absolutely honored to have as part of this conversation, which is basically what is tinnitus, a special friend of tinnitus, of the ATA, and now of mine, Dr. Sujana Chandra Sekhar from New York, an ENT who has a particular specialty in tinnitus and helped clarify and write and establish practice guidelines for the treatment of tinnitus. This is something that is rare in the field of physician practice, and we're lucky to have Dr. Sujana with us today. I'm going to bring Sujana onto stage now. I had the honor of meeting Dr. Sujana not long ago at a conference in Houston. Doctor, welcome. Thank you for joining us. Good to see you.
Thank you. It's really nice to be here, and it's really nice to have this conversation with you.
Well, we're honored to have you, and on behalf of the 70 million Americans we serve, thank you. What you do day in and day out is a real testament to, as you know, a great need in the community. So any insight here on tinnitus from your point of view as an ENT is beyond valuable. So thank you for your time. I thought maybe to get us started, so if in our hopes of kind of trying to nail down exactly what is tinnitus, especially from your point of view as an ENT and a medical doctor, we've got a few questions we wanted to kind of cover with you, but if we keep it as an informal conversation, I think that'd be really helpful. And maybe just to get us started, maybe you could help us understand from your point of view as a physician, what is tinnitus? Because I've even heard in my role as the CEO for a charity dedicated to it, I've heard differing definitions. So from your point of view, what's the medical definition of tinnitus, and why is it that it's so misunderstood? Why do there seem to be differing opinions on even defining the word?
So, as you know very well, you said from the beginning, you serve 70 million people. That's a lot of people with a condition that, as you said, has various definitions. So tinnitus is the perception of sound when there is no exogenous sound production. So it's hearing a beep or a hum or a high frequency sound, or maybe even your heartbeat when there's nothing on the outside bringing that sound in. And almost everybody, or maybe everybody, can experience tinnitus at some point. Often when it's very, very quiet, you have nothing else to think about. We believe that tinnitus, which is perceived when there's no external sound, is the sound that your brain remembers your inner ear making for most cases of tinnitus. Sometimes you're actually hearing your pulse. Sometimes you're actually hearing your heartbeat. If you've done a lot of exercise and your ears are sort of pounding. But for the most part, tinnitus is that sound that you perceive when there's no real sound being produced from the outside. Why is it a problem?
Yeah, that was my next question. Why is that? How is that a serious issue? Me hearing sensing a ringing noise, how could that possibly be serious?
So, right. Once in a blue, if you hear something funny, you stop hearing it, your hearing stays stable and normal, not a problem. You're exercising a lot, you're hearing your heart race in your ears, normal, not a problem. The problem becomes when that sound becomes persistent feels very loud, seems to take over the way you interact with the world, interferes with your ability to focus on conversations, to focus on work, even to fall asleep. So we see a lot of this um, in the huge cohort of people who have tinnitus. We have a smaller cohort of people who have persistent, bothersome tinnitus and sometimes severe or disabling tinnitus. And because it can be caused by many things, and because we don't have a one-size-fits-all treatment, like, for example, if you have diabetes, chances are insulin will help you, right? Pretty straightforward within the realm of uncertainty that is medicine. We don't have such a one-size-fits-all. So patients have difficulty describing the sound or the experience. Physicians, audiologists, our allied health professionals sometimes have a problem understanding what the patient or their family member is trying to say.
You're actually touching on what our next question was. Thank you. Which is for those folks who have this bothersome version of tinnitus. I mean, it's estimated as many as 20% of anyone who experiences some version of tinnitus have what you just referred to, bothersome tinnitus. Can you talk a little bit again from your point of view as a physician, how that can become very, very serious? One of the things I've come as someone who suffers from tinnitus myself, I would struggle to categorize it right now as bothersome. I've had it since I had chemotherapy treatment as a teenager. However, I have found it's difficult for me as a patient to even explain to my loved ones what it is. They almost don't even believe me. They think I'm exaggerating. I can't imagine if I had a bothersome version of this, how much more difficult that would be for me as a patient, just talking to my loved ones. How about from your point of view as a physician, understanding the bothersome piece of this?
Right. So I think that's very, very difficult because people can respond to their tinnitus very differently. So we don't have a way to measure tinnitus per se. We have some ways to measure the individual's response to what they're feeling. So we have a tinnitus handicap index score that you can count always, sometimes, never. Does the tinnitus bother you in 25 different domains? And we look at a score of between 0 and 100 to try to help us understand how bothersome, how disabling the tinnitus is for that person. We've all had the experience where there's been a loud squealing sound that's actually there in the environment. And let's say a microphone speaker is the microphone's in front of the speaker, and you hear that very high-pitched squeal, and you're like, oh man, I can't focus, I can't concentrate, I can't really listen to this conversation until that sound stops. Imagine if that sound never stops and no one else around you hears it. So they don't understand that you're struggling to participate in the world around you while trying to minimize the impact of that sound that's in your head. So the bothersome nature, or the and we're not going to go to catastrophic now, but the majority of people who we would consider tinnitus sufferers have really bothersome, chronic, persistent, bothersome tinnitus. So when they finally sit down in quiet to read a book, or they finally, get a chance to kind of lay their head on the pillow, bam, this loud sound that had been previously masked because there were noises in the environment, or their brain was really busy doing their work, or they were very preoccupied with something else. Now the brain is quiet, and for people with back pain, maybe you focus on your back pain at that point. Now, without wanting to, your brain is focusing on your tinnitus. And when it focuses on your tinnitus, it elevates the amount that you experience it.
Um, I'm trying to approach this conversation as a patient and not the CEO of a charity focused on this. And you're touching on a few things that I think are just really interesting for the sake of conversation. You mentioned going to a concert, hearing a loudspeaker. I mean, that kind of touches on another question we wanted to ask you, which is prevention. I mean, we all know noise exposure is the leading cause of tinnitus. You know, if I'm 45, I already have tinnitus for other reasons that are not related to noise exposure. They're from cytotoxins. But if I were looking to prevent making this worse, for example, what are some things I can do in addition to avoiding standing next to the speaker at my favorite musician's concert?
Right. So I actually was just talking to a pathologist this week who came into the office and just, went to a really great concert when he was young and had great seats. And ever since then has had some hearing loss and some tinnitus. And there's no concert worth that. There's no movie worth that. There's no nothing worth that. Right. So, before I get to this question, let me just say that many, many, many times when we see somebody with tinnitus and we do a hearing test on them, we can measure hearing loss, usually in the higher frequencies, sometimes in extended high frequencies where we normally don't measure, but if we take the time to measure, we can find some hearing loss. And a lot of my patients say to me, oh yeah, my ringing is causing my hearing loss. And the answer is no, actually your hearing loss is the precipitative effect that's causing your brain to focus and try to fill in that hearing gap with those remembered sounds, whether it's a beep or a buzz or a machine or a refrigerator hum. You can use many different words to describe the sensation that people feel. So we're really very aggressive in otolaryngology and in my audiology colleagues, who are the people who test hearing and provide hearing aids. We're really proactive from young childhood, teenagers who really have a high level of exposure to noise. In the military, there's a lot of concern about exposure to noise and trying to give them the proper, let's say, earplugs while keeping them safe in a military theater. And certainly as we get older. So over time, otolaryngologists, I'm very proud to say, led the way in making sure that children's toys did not go above a certain decibel level. Because before the 60s, those horns on your bike, the rattle, they were ridiculously loud, and they were small little heads that were exposed to those sounds. There's noise ordinances in every single city and every single township, because we know there were some really elegant studies done again in the 60s and 70s that schools that had playgrounds outdoors in the path of airplane takeoff and landing from nearby airports, those kids had a higher incidence of hearing loss, and you can then say subsequently tinnitus, than children whose playgrounds were not in the flight path, as the plane was close to the ground.
And we have the data to back this up now. So
we absolutely do. Yeah. So then I tell my my parents and my patients who are teens, preteens, starting to use their personal amplification devices, their iPods, whatever. You know what? You got to keep that volume below 80 decibels. You have to give your ear some listening breaks. If you have to shout to be heard over your headset is too loud.
I like that tip. I'm stealing that one, and I'm delivering it the same way.
I think you should. It makes people crazy. So, and I think when you go to a concert, I tell people, listen, put a pair of even foam earplugs in your going out pants, your going out jacket, your going out purse, whatever it is. Put the even if you put a pair of foam earplugs in that are, 50 cents or $1, that's going to dramatically protect your hearing. If you can splurge a little bit, there's some really nice over-the-counter earplugs, noise reduction earplugs, where they filter really well so you can hear the music beautifully. Like your favorite singer, your favorite rapper still sounds awesome. You can hear all the words, but you're not causing toxic damage to your inner ear. And there's a lot of data, which is relatively new, that the what we used to think was a temporary threshold shift. That meant when you and I, Patrick, went to concerts when we were young, and we were like, oh, that was a great concert. That was a great club. I'm a little deaf. My ears are ringing. And by tomorrow, I'm going to be fine. Like that was the measure of how awesome it was, right?
Yeah. If you heard that ringing when you left, it meant you had a good time.
It meant you had a great time, right?
Yeah.
So now we know, unfortunately, that what we thought was a temporary shift will actually immediately and permanently damaged these things called synaptic ribbons that are in between the inner ear hair cells, and they don't recover. The hair cells themselves do. So what we see is that same 18, 20-year-old person who had a great time at the concert at 45, 50 suddenly is having some tinnitus, maybe some bad tinnitus, some difficulty hearing and understanding in noise. So the earlier we protect and the more consistently we protect our hearing, the better. And even like I'm in practice in New York, right? Sirens are going by, whatever. You never know. Even just doing this is enough. Pushing your tragus, which is this little triangle, to close your ear canal when a siren goes by is enough to prevent that. Because we do see people with acute noise exposure, maybe coupled with a lot of caffeine, maybe coupled with alcohol, maybe coupled with dehydration, who develop this tinnitus and they really can't shake it for a long time, sometimes forever. You mentioned chemotherapy. There are certainly drugs that we know that cause inner ear damage. And I think it's really important that your healthcare provider listens to you. If you say, hey, wait a minute, something's going on with my ears when you're giving me that medication, because they may be able to give it to you at a lower rate. They may be able to dilute it a little bit. They may be able to pick something that's less potentially toxic for you. Obviously, I personally, having met you and become your friend, am very grateful that you're alive and well. But the least, secondary damage that we can do, the better for the patient.
My oncologist, he's since retired, but he was a massive proponent. He was a pediatric oncologist, a massive proponent of reducing secondary damage with his patients because he was treating such young patients.
Right.
Obviously, you mentioned something that I think is interesting. I wonder if this is a fair analogy to make. You were talking about toys in the 50s and 60s, and there was no threshold for the volume there. And then as we were growing up, it was cool to go to a loud concert and have that pain leaving. I do sense a shift in popular culture in terms of awareness of hearing healthcare. And I wonder if it's akin to seatbelts in the 50s and 60s when they weren't even mandatory. And then maybe they were in cars and no one was really wearing them. But now I feel like seatbelts today are, even if you get into an Uber, most people are probably wearing their seatbelt. And we know why. There's data that shows the efficacy of a seatbelt and protecting yourself in a car. I'm wondering if it's a similar shift we're seeing with hearing protection, because even my Apple Watch will tell me if the restaurant is too loud now. And I'm noticing infants with hearing protection at football games or basketball games. So it seems to be seeping into popular consciousness that hearing healthcare, based on the data and the science you've been citing, is now shifting the popular mainstream understanding of us just covering our ears when there's loud environmental noises.
So I would like to say that that's 100% true. And I think it's much better than it used to be. And I think you're right. All our smart appliances, smart watches, smart this, smart that tells us things, right? Which is great. I was at a movie a few years ago with my sons, and Maybe my daughter was there too. I'll throw her in.
We'll give her credit. Yeah.
We'll give her credit. And I'm like, wow, these previews are so loud. And I always have a decibel meter on my smartphone. And I'm like, oh my God, these previews are at over 100 decibels, over 110 decibels. And the louder your exposure over 80 or 85 decibels, the shorter time it takes for permanent damage to happen. And that permanent damage often is hearing loss, but is experienced as tinnitus, right? Because it's up in the higher frequencies where, it doesn't really interfere with conversations, but suddenly you're like, and it's just there now because you've now heard that 6,000 hertz, that 5,000 hertz frequency. So my son and I, who was in high school at the time, and then went into college, did a little study, and we measured these movie trailers, and they were so loud. And the movie theaters that tell you we have Dolby Stereo and we have surround sound and we have this and we have that, they might as well say, we are just making you deaf. Come on in. Pay us the money and come get
us to injure you.
So I think there is more awareness. I think everyone needs awareness, and we all know that, we feel the most invincible as teens and young adults, right? And I think it's really important that we keep up, not in oh, you can't listen to your music. No, listen to your music. Keep the volume below 80 decibels. Turn up the bass. Like people who like rap, people who like sort of pounding music. I happen to love rap music.
I did not know this about you, and we need to talk about this offline. I sense fascinating conversations in our future, but go on. Turn up the bass is what you're telling me?
Turn up the bass and then turn down the volume, and you'll still get that sort of like exciting vibratory effect, right? That head bopping effect, but you won't be damaging your ears.
Wow. When my girlfriend complains that the bass is too loud in the car, I am citing Dr. Sujana. I'm just doing what the doctor told me.
Just doing what the doctor said. Have an apple, honey.
Thank you. I'm doing that. And we have this recorded as proof. I'm gonna shift my next question a little bit here, and I'm gonna sing your praises for a second, if you don't mind me embarrassing you here. You, if I'm sharing the right screen here, which I hope I am. Yes. So I believe you were an instrumental part of helping develop some clinical practice guidelines as they relate to tinnitus. And, the next question is sort of related to our first question, which is not just understanding what tinnitus is, but then understanding this bothersome category and what it means for someone who has catastrophic or bothersome tinnitus. But from a physician's standpoint, and I would imagine these guidelines are a massive part of this. But from a physician's standpoint, why is it important for any healthcare provider to understand the emotional and mental side of tinnitus? And you already mentioned earlier when we were talking about chemotherapy, in my personal experience, that it's important for a physician to listen and pay a provider to listen and pay attention to telltale signs. What would you say is critical for a healthcare provider to understand when it comes to the emotional and mental side of tinnitus? And then conversely, let's say a physician or a provider doesn't have time to take on a tinnitus patient. What should they then do?
So I'm going to answer your second question. They should take the time, because none of us went into medical fields to not take time with our patients and to not understand our patients and to not even give it the proper try to help people and to let people know that we are doing our best to help them heal and to help them establish a quality of life that is good for them. So you may be rushed, you may have to pick up your kid from daycare, whatever, as a physician, as an audiologist, as a nurse practitioner. So then say, listen, I know you're having a real problem. Let's set aside some time to talk about it. Let me give you some pointers on what you can do now. And then let's really talk about this. Unfortunately, I can't talk about it right now. That's a very reasonable answer. But frankly, make some arrangements. I mean, if I ever come home early from work, my kids are all like, "Oh my God, Mom, did you get fired?" I'm like, nah, I mean, it's a calling, and it's still a calling. It's still a calling, and it's a wonderful calling. I have a very rare job where I get to meet people very intimately, 25 to 30 patients a day. I meet them and their families. They trust me. They share information with me. And I need that information to know who they are and how best I can help them. So, so they need to make the time. In terms of the emotional, psychological toll of tinnitus, it is really, really important. And one of the things we determined as we looked, so clinical practice guidelines are actually what's called they're very, very long. It takes a year and a half to write one. It takes 17, 18 people to write one. It's a systematic review of the literature as it stands at that time to try to understand what works, what doesn't work, how should we counsel people, what is the best way we can help people at this time. And you'll notice that the date on that is 2014. So we're actually gearing up to do an update. And luckily we are gearing up to do an update because there's a lot more information and a lot more potential treatment options that I would like to share with my fellow otolaryngologists, with audiologists, with families, with patients. So because these guidelines are written in a way that anybody who has anything to do with the subject matter of the guideline can gain something meaningful from that guideline. So what we found was that there are people whose underlying depression and anxiety is an actual medical issue, is an actual psychiatric medical issue. And in those patients, their response to tinnitus can be much more heightened. They can have a much worse outcome. When they have an actual diagnosable depression or anxiety, and their tinnitus is making everything worse, treatment of their underlying depression or anxiety with the appropriate psychiatric interventions, whether it's medication or counseling or both, is very effective. The majority of people with bothersome or catastrophic tinnitus don't actually have an actual diagnosis of depression or anxiety that you can make, but constantly living with, right, in your brain, they don't sleep well, they don't think well, they don't have a moment of peace. I mean, peace is so nice. Like when my kids were small and Calgon, take me away, right? I would just leave. I would be like, okay, I'm back in 10 minutes. Take a quick walk around the block, be with myself, right? If at that time my tinnitus accompanied me, the restorative nature of that walk would have been much less. Right?
Sure.
So we found that even in people whose tinnitus is provoking anxiety or depression as a response, but not as a diagnosis, not as a disease state, they did incredibly well with cognitive behavioral therapy. It was one of the few treatments that really helped our patients. And this is based on, a systematic review of the literature, not just my opinion and a few other people's opinion. So cognitive behavioral therapy is used for a number of conditions, and it's actually been touted recently in chronic pain management as we're trying to get people off of opioids and healthier, but managing their pain. So you can look at this bothersome, disabling, catastrophic tinnitus as a type of a pain pathway that sort of takes over everything else that's happening in your brain. And so cognitive behavioral therapy takes the experience and tries to separate it from the anxiety depression response, which is sort of giving more weight to the experience. So it's a talk type of therapy. It's a mindfulness therapy. It's a understanding, like when I tell patients, well, your tinnitus is because you've got this high frequency hearing loss that I can measure. I can help you. Hearing aids can help you with this, but really understanding that this is not the way you have to live, and this is not heralding a problem. A lot of people are worried that this is some brain tumor that's, like my job is to say, you know what, you're going to make it through this. Let's give you the tools to make it through this. And now we have even more therapies that we can try with them. So if you go to a doctor and they say, oh, you have tinnitus, just live with it, you might need to see another doctor.
Well, you are segueing into my questions before I can even get to them, because cognitive behavioral therapy, CBT, is something I learned quite a bit about in the last 6 months. Again, in my role with the ATA, and as a cancer survivor, a current cancer patient, I had an ankle fracture right after we met. I don't think I've told you this story. So I had surgery for my ankle recently. So pain management was a newfound joy in my life the last few months. And the little bit I've learned about cognitive behavioral therapy for tinnitus has actually helped with some of my pain management. Mm-hmm. And that's evidence-based, peer-reviewed science that supports these types of treatments. So, but when I'm sure you've heard the story more than I have. The founding of the ATA with Jack Vernon and Charles Eunice is based on Charles Eunice, a patient, being told, deal with it, learn to live with it. And that was over 53 years ago. And patients are still being told that today. So I'm one of them. I was told that 20 years ago. Mm-hmm. Inclusive of CBT, cognitive behavioral therapy. What are, again, from a healthcare provider's point of view, what are some things that we can tell a patient beyond just deal with it?
So I think the journey of the patient with tinnitus should start at their primary care doctor. They should get a hearing test, and that can be ordered by the primary care doctor, or they can refer over to the otolaryngologist or the ENT doctor to order that and make sure the ears are free of wax, make sure there's nothing else going on in the ear. Once the hearing test is obtained, we're looking for symmetry. So physicians hate when one side is different than the other. So if there's an asymmetry, so one side is bad and one side is good, we will probably order some imaging to make sure there's nothing impinging on your nerve of hearing that's causing this problem. So let's say you get a clean bill of health, but you have some hearing loss and you have some tinnitus, and you're really there because your tinnitus is very bothersome. All of the studies that have been done on tinnitus are when tinnitus is persistent, which is that it lasts longer than 6 months, and it's bothersome or worse. So a lot of people come in because their tinnitus started yesterday, and good news for them, the vast majority of people with acute onset tinnitus or recent onset tinnitus will feel better on their own. Their tinnitus kind of fades away into the background once they realize that they don't have a brain tumor, that they don't have something else bad going on. And if they have hearing loss, if they wear hearing aids, that usually helps with the tinnitus as well, because it just restores that perception of sound. So the brain stops wasting its time searching for old sounds and perceiving tinnitus. But if you have persistent bothersome tinnitus, try the hearing aids because they really work. Other things that we can tell them, learn to live with it, like, learn to live with it and get out of my office, is very different than, you know what, this is a thing. Let's make this the least bothersome thing it can be for you. So how do we do that? How do we get you to learn to live with it compassionately? Because as you learn to live with it, your brain kind of gets bored and stops paying attention to it over time. So hydration, really important. Avoiding excess use of caffeine, very important, because caffeine is a vasoconstrictor. It constricts small blood vessels. And some of my patients, I get flowers when I just tell people, stop drinking your pot of coffee in the morning, go down to 1 cup and make the rest of it water. And 3 weeks later, I got some roses in the exam room, which is very nice, right? So hydration is important. Avoidance of excess caffeine is important. Avoidance of nicotine in general is important for your overall health, but certainly because it is a vasoconstrictor. One of the things that causes dehydration is alcohol. So it doesn't mean you can't have a drink. It means you should have a full 8-ounce glass of water chaser if you have a drink. If you are using the alcohol to treat your anxiety and depression from your tinnitus, that's a conversation I'm going to have with you. So if you're really drinking in excess, and there are very clear protocols for men and for women about what is considered socially acceptable, medically acceptable drinking, I'm going to say, and I've had this conversation with patients, what is it that you're medicating? What is it that you are treating with alcohol, which is not a good medicine, that I might be able to help you with in other ways? I think knowing that this is under control, that you're under some compassionate healthcare, is very helpful. One of my professors who I adored, Dr. Sheehy, used to tell people, treat your tinnitus like your socks and shoes. They're on your feet, but until I mentioned them just now, you didn't feel them, because it's a waste of time for your brain to be telling you for 12 or 18 hours a day, you're wearing socks and shoes, you're wearing socks and shoes. That's crazy, right? And it's an interesting way to think about it, right? It's an interesting way to say, yeah, let me start ignoring my brain's dummy tinnitus, and let's see if we can just make that go into the background. You can always summon the tinnitus. So many of my patients are like, I do great with my tinnitus until the day I have the appointment with you. Once I think about you, I think about my tinnitus, and it comes back, and I'm like, oh, like, okay.
The chicken, what comes first, the chicken or the egg?
Right. And it's, so I think there's a great deal of mindfulness. I think the use of hearing aids when appropriate is really important. I think dietary lifestyle modifications, if you aren't moving around, move around. B vitamins are very neuroprotective to the inner ear. So if you're not getting a B vitamin rich diet, take some, B complex or a Flintstones chewable. I don't actually care what vitamin you take, because there's plenty of B in the vitamins that you take. If you have acute noise-related tinnitus, there's been really great studies in the military, unfortunately, with soldiers exposed to blast injuries, looking at N-acetylcysteine, which is available over the counter. It's an essential amino acid, and it's used for various things in the vitamin and mineral aisle. That in an acute phase really helps. Sometimes if it's an acute injury and we want to see if we can nip it in the bud, some steroids at an acute, like within a couple of weeks of onset, may help you. And then there's some, apart from the hearing aids, which is a device that I talked about, you can use masking devices in the room. So you can have just sort of like a waterfall thing in your room. You can have your cell phone making shh noises for you. Cool mist humidifier in your bedroom makes that noise, which is very soothing and sort of masks the tinnitus. So it just sort of equal and opposite, just gets it out of your brain's path, and it makes the air nicer for you to breathe at night. It makes you sleep better. If your partner does not like noise, your bed partner does not like noise in the room, you can actually get something called a tinnitus pillow, which will put masking noises into your pillow in a very comfortable way. So you can move around during the night on your pillow and you'll still get the masking noise available to you. And then there's some newer stuff. Want me to talk about it?
I could spend an hour with you just talking about the newer stuff. One of the things that's fascinated me from my seat as a patient advocate here in this role is the reality that there is no one size fits all. And it's, I'm almost ashamed to admit this. I used to practice corporate healthcare law. So I've been in healthcare as an attorney, as a patient, and now as a in a public charity role. And I still have this preconceived notion that science has a magic wand for any ailment, whether it's my broken ankle or my tinnitus or some other thing. And tinnitus is not that. Hearing healthcare is not that overall. I think it's fair to say, but with tinnitus in particular, there's no one size fits all, and it's a journey depending on the patient. And what may work for one does not necessarily work for the other. And so it's really about actively exploring um, the options with your physicians, with your providers.
Yeah, and it's having a healthcare provider who's a little bit of a detective. So I don't know if you know this about me. I became a physician because my heroes, other than Marie Curie, who's my number one, were all the detectives whose stories I read, starting with Encyclopedia Brown and Two Minute Mysteries when I was a kid, to Sherlock Holmes that I just devoured, right? And Harriet the Spy in the middle. And I said, what can I do that I can be a detective and still like put food on the table? And to me, medicine is the ultimate in being a detective. So I will ask patients not only about the caffeine, the alcohol, the, nicotine, the water, but, tonic water has quinine in it. Quinine is toxic to the ear. So quinine is what's in malaria pills. So the reason the gin and tonic was invented in the British invasion of India, right? This is so cool. I have a cool life. So the reason gin and tonic was invented is because these Britons who were in India needed to combat malaria. And so they had to drink their tonic, which was quinine. And to make it palatable, they chucked some gin into it. So
I can't. Wow.
So if the patient's like, oh yeah, I have a G&T, 5 times a week, right? You wouldn't bat twice, but I was like, how about some gin and juice a la Snoop, right? So then you get rid of the tonic and maybe not drink so much. But, so there's aspirin. Alka-Seltzer has aspirin in it. There's some really hidden sources of what we consider ototoxic agents. So I think being very straightforward with your healthcare provider, giving them the space to understand who you are and giving yourself the space to explain who you are is really important. And yeah, everybody comes in and is angry at me because I'm not giving them the magic pill or waving my magic wand. But the magic is in understanding, is in realizing what's going on, and then taking advantage of the treatments that we know that we have to offer.
Thank you. And I was also a huge Encyclopedia Brown fan growing up. And I ended up majoring in philosophy in undergrad and then law school after that. And law school is famous for using what's called the Socratic method, which is based on Socrates, who started everything off with, all I know is that I know nothing. And that method of lecturing in law school is famous because it's just a professor asking question after question and following the logic where it goes. And as I'm sure you know better than I do, I think we talked about this when we met. The Socrates and the Socratic method is part of what led to what we know today as the scientific method itself, right? Ask the questions and be honest with the results.
Right. And be willing to say, oh, what I believed with my heart 10 years ago, I don't believe anymore because science has progressed. So you really need healthcare providers who keep up with their continuing medical education, who have an open mind, who want to understand. Like, we didn't really understand naturopathic medicine in the Western world for a long time. And I'm Indian American. So my aunt had, 6,000 different cures for what ailed me. And they worked, like if I had a sore throat, I never got an antibiotic. She roasted some almonds and some black pepper and I sucked on them for a while and I got better. Who knows, right? So I think the more we understand, the more we incorporate the holistic approach to the individual in healthcare, the better we do for them.
Well, doctor, thank you. I don't want to take any more of your time than we already have. Hopefully, we can keep this conversation going. I think it's going to be very beneficial to our audience and to folks who are suffering from tinnitus. I'd be remiss if I didn't also just mention to folks who have gotten this far into our talk, ata.org is a great resource for folks who are looking to learn more, or you can call our 800 line 24/7, 1-800-634-8978. If you're looking for help in your area, the ATA helps promote things. We have our Tinnitus Advisors Program. We help promote local peer support groups. And if there are resources in your area, we'll try and help you track them down. So to your point, doctor, never stop that pursuit. Channel your inner Encyclopedia Brown and try and find an answer, I guess.
That's right.
And stay away from Snoop's advice. The gin and juice is not.
Well, it's gin and juice. It's
Oh,
not
gin and juice is the
tonic.
answer, not the gin and tonic. You're right. So
As
Snoop
always,
was onto something. He always
as
knew.
always, Snoop is right.
All right. Again, it's from the doctor's lips to your ears. I didn't say it. Well, doctor, thank you so much for your time. I can't wait to connect with you again. And on behalf of our entire audience, thank you for everything you do.
Thank you so much. Thank you for allowing me to share, hopefully, a little wisdom and definitely some laughs with you. And, never ever think of these things as sort of this life sentence. There's always something we can do and try. And you just need the patience to do that.
Well, thank you for the resources and the insight. And I can't wait to see what we figure out next. Thank you.
All right. Take care.
Bye.
Bye.
Please consider a donation today.